Erythropoiesis. Erythropoiesis, it is a process of formation of RBC. Erythropoiesis is the formation of RBC. So let's know about erythropoiesis. Erythropoiesis starts in the fetal stage. During fetal stage, when a child is not born, or when the child is in the womb, during the fetal stage, the erythropoiesis starts, and it is start by the mesoderm layer. First, by the mesoderm layer. There are three layers: ectoderm, endoderm, and mesoderm. The middle one, mesoderm, produces the RBC in the first stage, and mesoderm produces RBC during first 3 months of fetal stage. After this, the liver produces RBC during the 3rd to 6th month, and then during the 7th to 9th month, the bone marrow of the bones produces RBC. Second, in the child stage, after the birth of the child, during child stage, the erythropoiesis will occur to the age of 20 years, approx 20 years, in the bone marrow of all bones, liver and spleen. These all things, bone marrow of all bones, liver and spleen, they will produces RBC up to 20 years age. During the adult stage, the RBC or the erythropoiesis will be performed in the bone marrow of specific bones only. So this is all about the erythropoiesis stages: the fetal stage, child stage, and adult stage. Coming to the process, in the erythropoiesis process, the RBCs are produced from a single cell. There is a single cell which produces RBC or WBC. The cell is known as pluripotent stem cell. The stem cell, as the name suggests, it can give rise to any cell. The pluripotent stem cell, it can form RBC or WBC. It changes to proerythroblast, then it changes to early normoblast, then intermediate normoblast, then late normoblast, then reticulocyte, then erythrocyte, which is known as RBC. So at last, as we can see the process, the pluripotent stem cell changes to proerythroblast, early normoblast, intermediate normoblast, late normoblast, reticulocyte, and erythrocyte, which is the RBC. So this is how the erythropoiesis takes place. One thing you need to keep in mind, that pluripotent stem cell, it has nucleus, whereas the erythrocyte RBC, it has no nucleus, it is devoid of nucleus. So this is all about erythropoiesis.